This is the first time we can chronically record brain activity. In the past, this was possible only leaving electrodes outside the body, so only for a few days max. Now we can access the brain anytime we want.
Up until now, when we've implanted these devices in patients, we've been unable to know what the brain is up to. Now what we can do with this technology is at any time we can record brain activity, whether it's a day after surgery or whether it's 2 to 5 years after surgery. And that provides the clinicians a lot of data that we can react to and optimize the therapy and potentially further improve the quality of life of our patients.
Do you mind keeping your hands out and your legs out? Exactly like when you go to the cardiologist and you can see real time what's happening to your heart, you can see what happens to your brain. What we were seeing was exactly the way the neurons were behaving while we were talking to the patients, while we were asking him to move or not to move, and you could see how the neurons will react to what the patient was doing. We've been using 1.5 for your left body. Okay, let me have a look at your tremor. Is well controlled now. Parkinson's patients have a lot of what we call fluctuations, so they might move well sometimes, they might not move at all in other moments, or they might move too much other times. Their condition really changes by the minute, and for this reason, having the opportunity to really keep track of their activity, the brain activity over time, will help us understand why the brain behaves this way, and we'll be also able to tackle these problems in a better way and give them the treatment they need when they need. I'm sure you'll be in good control of your disease, and also we will be able to reduce your medication even more.
Perfect. So what you see here is the patient's brain, and this operation, what we have to do is very accurately deliver electrodes that are about 1 millimeter in diameter down to a target deep in the center of the brain that's only about 7 millimeters. So here you see these dark shadows coming here and here on the left and right side of the brain. You see those electrodes in the center of the brain at our intended target, and each of these darker spots here is a contact, and off those contacts they're like microphones. That's where we can listen to the brain activity, and that's also where we can stimulate to deliver the therapy. Up until now, only during the operation that we have access to the patient's brain activity. Now with this new technology, we can access similar information without having to do something invasive like having open brain surgery, and we can record the patient's brain activity at any time.
Well, it doesn't happen every day to see what's happening in someone's brain, and we always wonder, right, what's happening in someone's brain, and more so in a patient with a neurological condition. This is pretty unique and pretty exciting for all of us because we'll learn a lot about the way the brain works, not just about our own patients and the disease we treat, but also in general the physiology of the brain, which is very difficult so far.
The next generation device will be able to sense the patient's brain state and automatically make adjustments to the therapy, and the patient will have a much smoother course through the day and, in theory, a much better quality of life. For many other disease conditions, the field is wide open. For things like epilepsy, we would have the capability of detecting seizures before they happen and potentially stopping seizures. With other more difficult to treat conditions like depression, obsessive compulsive disorder, we would have the ability to potentially monitor patients' mood and changes in their mood and adjust the therapy accordingly. So the potential is vast. It's essentially unlimited.